I'm delighted to welcome Dr. Sarah Crozier and Dr. Kirsty Ryninks from the UK TTP Psychological Professionals Network. We are really blessed in this country to have psychologists in every site of the specialist TTP, or even just have specialist TTP centres to be fair, but to have a psychologist in that team as well. And they themselves have formed a brilliant network where they link together and share knowledge and experience, which can only be to the benefit of patients. So please give them both a warm welcome.
Hi, I'm Sarah. So I work one day a week into the East Midlands TTP service. I've been part of that service since January 2023, and I see all newly diagnosed patients as a standard, and I'm also open to referrals for outpatients who have been diagnosed with TTP at any point, sort of irrelevant at the time since their diagnosis.
And I'm Kirsty. I work in the Bristol team, and I've been working there since March 23 when we first got a psychology post as part of the service, and I've been working with patients since then. And I routinely see all newly diagnosed patients when they come into the hospital, just go and introduce myself as a face and a name that they'll come to know contacting them, and offer everyone a post-diagnostic assessment around 6 weeks after they've been diagnosed. And I also see any inpatients who had a relapse, and also open to any outpatient referrals, whether someone was recently diagnosed or diagnosed a very long time ago.
We've also got our colleagues Carolyn and Ika over on the table at the back there. They're here today, and they've got the table which Joe mentioned up in the corner that's got lots of useful information and resources that might be helpful for you. So yeah, please do visit them in any of the breaks or networking time to be able to get that information. So we're going to talk to you about the psychological responses to TTP. We're going to go and try and do this through a patient journey. So we're going to talk to you about the psychological responses and try and do that going through a patient journey, sort of with typical common responses that people might have. And then we're going to move on to looking more at the psychosocial support that might be available to you in your individual centres. At this point, just supposed to give a bit of a warning really, and provide a bit of a health warning. So some of the things that we talk about might be quite triggering for people. Some of what we speak about might be relevant to you, it might not be as well. So please do just take care of yourselves and do what you need to using the breakout rooms that Joe has mentioned at any point, and there's volunteers from the TTP network to support you if you do need to use those.
And then we'll finish off today just looking at some of the psychosocial support that's available at all the different centres and how you can get in contact with us. So this slide is just summarising these stages that we've noticed many of our patients across our network often perhaps move through, and when someone's being diagnosed, and it can be a cyclical pathway that you follow, or sometimes people may move back and forth between the different phases, or find themselves in different phases at the same time. So they're being acutely unwell, emergency, initial recovery, impact on family, fear of relapse, and living with TTP. And we'll talk through all of those over the course of this presentation.
So the first phase is being acutely unwell. So some people may have noticed the onset of symptoms in the lead up to being diagnosed with TTP. Other people might not have had this experience, as they might have been asymptomatic or had other things going on at the same time that they attributed their difficulties to. So we've heard this morning about people with pregnancy and things being linked to just being pregnant. But the sense of emergency and urgency when TTP is diagnosed can therefore be quite difficult to make sense of, and what happens next can feel quite disproportionate for some people. For most people, though, the experience can be utterly terrifying. So the sudden onset of symptoms can cause shock and fear, and it's normal to question what could be causing these symptoms. Often people appropriately seek medical and healthcare professionals to try and understand this, sometimes multiple times. And if that diagnosis is delayed because of the rarity of the condition and people not picking up on it, it can intensify that sense of alarm that patients can feel.
And the next stage that we've noticed is what we've termed emergency, where people may then find themselves in the emergency phase, where, as Sarah's mentioned, there's that shock at the initial diagnosis, but also the separation from loved ones without notice. And that in itself can be incredibly overwhelming and often result in lots of fear and anxiety and loss of control, worries about what's happening to children who've been left when you've just suddenly been whisked into hospital. And so sometimes people do develop some traumatic responses because of what they've experienced. So this is where we always say drawing upon support systems, the specialist TTP team, your own support network, the TTP network, is really helpful. And just remember they're there to support you, whether it is this emergency phase or throughout your journey. And hearing a diagnosis, especially one that is so rare or life-threatening, we know can feel quite surreal. And that shock can often lead people to delay or struggle to comprehend the news, which can be quite protective initially. Once you've managed to shake perhaps some of the emotions of fear and anxiety, the focus might then be on not knowing what to expect next. And that uncertainty about the future can be really difficult to process. With that loss of control can also sometimes come a sense of loss in other areas, whether that's to do with our health or independence, plans for the future, or even identity. And some people often feel quite a sense of grief at what they've been through in that particular phase too.
So after the initial diagnosis and the emergency phase, people might find themselves in the initial recovery period. So this might be still in hospital if you've got a longer admission, but also for some it can be about being discharged home. It, like I say, often looks quite different for different people depending on your experiences, and also about how quickly treatment started, any complications or any side effects that people might be experiencing or have been left with following their initial sort of period of ill health. We've also noticed a significant difference between the experience of those that were diagnosed a long time ago versus those who were more recently diagnosed, and particularly since the creation of the TTP specialist centres. So some people may have had prolonged admissions, like I said, but other people can talk about a whiplash effect, where they're suddenly thrown into the need of ITU admissions and needing treatments, and then very quickly for some people, you're then discharged home and into that recovery phase. So hospitals can feel like a safety net for some people, and it can therefore feel quite scary and challenging when it's time to be discharged home. There may be lots of anxiety around this and a sense of that needing to rebuild the trust in your body because it's gone from all of this, as well as an urge to check your body more often. So being discharged home is often the start of that processing and coming to terms with what's happened to you. There might be relief and gratitude that you've survived, but also sadness and grief for what's been lost. So it can be a really difficult and confusing time with lots of different emotions.
And as has already been spoken about this morning, we couldn't not mention the impact on family members. And this is, the impact on wider family, but also your immediate family, your friends, your social networks. For them, they may have experienced significant fear and anxiety in seeing their loved ones so acutely unwell. So we've already heard lots of people not really remember that acute moment when they were in hospital, but it's the loved ones who were there and witnessing it firsthand. Perhaps they've got more recollection of traumatic memories of what actually happened than patients do themselves, as you may have been too unwell yourself to notice what was happening. And we know family members often are left feeling quite helpless and really isolated, exacerbated by being diagnosed in COVID, and services aren't always designed to support the wider network. We know there can also be differences between those who have immune versus congenital TTP, and the impact that can also have on someone's decision making around the future, and also in terms of the wider family. And one of the things that we as a network really want to be working on and investing in this year is thinking a lot more about how to support families, resources for families, alongside the new leaflet that TTP Network has helped produce with some of the nurses from Birmingham here, in acknowledgement of how challenging a time it can also be for family.
So another phase that we support people through is their fear of the TTP relapsing. So for everyone with TTP, there's this period after a diagnosis of adjusting to a new normal, whatever that might look like, but knowing that it needs to include routine monitoring of their bloods becoming a part of their everyday life, basically. Not every day, but yeah, regular part of life. We know that a certain proportion of people will relapse within the first few years after initially being diagnosed, but for others they may not relapse for some time or even at all for some individuals. And it's this uncertainty that can understandably be really challenging for people to navigate. So some people really struggle with hypervigilance, so that needing to constantly look out for signs within their body that they might be becoming unwell, or they could get caught up in cycles of worries about the future and what that might look like. The lack of control can sometimes lead us to make changes in our behaviour to try and minimise the risk, so people can find themselves researching loads about TTP and making changes in their lives to try and avoid relapses in the future. People may also find themselves struggling with a sense of hopelessness, and some may develop post-traumatic stress or anxiety responses to what they've been through. So that hopelessness feeling is that it's a feeling of despair or a belief that things will not improve. And so after that initial recovery, the uncertainty about the future can make people feel emotionally overwhelmed, and it can be hard to see a way through it. And you can find that sometimes people will withdraw from others and sort of lack motivation to be able to do things, that just sense of general apathy.
So you should all see on your tables, we've handed out a leaflet, a green leaflet from the network, and also in your packs you will find I don't know if you found that there's a little set of bubbles, and you might be wondering why has that been included in my pack. Well, research has shown that breathing exercises can really help to reduce the symptoms of stress, anxiety and depression. And when people are anxious or stressed, they tend to breathe in more quickly, faster, and not breathe in and out for long enough. And in extreme cases, this can sometimes lead to hyperventilating. When we do this, and our breathings become quite fast and shallow, that can change the balance of oxygen and carbon dioxide in our body and trigger even more anxiety, fear and panic. So it can be really helpful to retrain our breathing and, to be technical, activate our parasympathetic nervous system, which instantly calms the body and the mind. So any breathing exercise that lengthens our out-breath is really helpful. And one fun way to do that is by blowing bubbles. So that is the reason that you have bubbles in your pack. The act of breathing to create a bubble means that your out-breath is automatically lengthening, which is what we're aiming for. And the bubbles that you create give you something to focus your attention on. And you might even want to try a technique with the bubbles where you place the bubble on the thought and you watch the bubble float away, or just chase them and pop them with your finger. And the idea is to practice this regularly when you're feeling calm, so that you perhaps might be better able to utilise that breathing technique, whether or not you have bubbles, in the moment when you need it. So that's your take-home homework, practice your bubble breathing on today.
So then the final phase is living with TTP. This is all about finding your balance between living with the TTP and keeping yourself safe, while also living the life that you want to live that's consistent with your values and giving purpose. So relapse used to be a very different experience, but now with the regular monitoring and the specialist centres, people's experiences can often be much better. And yet it can still feel like a bit of a ticking time bomb. There's huge uncertainty and it's quite difficult to be able to live with that. So everything can become more medicalised with TTP. So having to have that considered in all decisions that you make, sort of going on holiday, changing jobs, starting a family, thinking about where to live. There can be challenges for the family in their loved one is now dependent on other people, whereas before they were perhaps the person that others relied on. So relapse, if it happens, is often not the same as the initial traumatic diagnosis. Patients quite often describe having more confidence in their TTP team and in themselves, along with better treatments, and centres working with patients to ensure that patients have a voice and can be heard. These changes to services and the personal experiences of those who have relapsed can help to find a way of living with TTP, so it's a bit more comfortable. People also often speak about a shift in their priorities after TTP, so having had the experiences leads some to be able to reevaluate their lives. So the life is too short mentality to allow you to start living life, but also a new appreciation for your resilience and your strength that you might have found from having gone through it in the first place.
So those were the 6 phases that we sort of noticed many patients they fall through. And if there are things that we've spoken about there that you identify with, it might be that you'd like to think about some psychosocial support. And as Joe said at the beginning, all the different TTP centres now have a psychologist as part of them, and together we form the TTP Psychological Practitioners Network. So this is who we are. You may recognise some of the faces on this slide. And there are 4 of us here today, so myself and Sarah, and also our colleagues Ika and Carolyn, but we're just 4 of the 12. And we meet online every 6 weeks or so to share knowledge and expertise to support each other. Many of us were creating services in our respective centres at the same time, so we found it really helpful to draw upon each other as part of that. And we work together to increase awareness of psychological difficulties and also to support our patients and family members who've experienced TTP.
So as many of you will be aware, a few years ago NHS England commissioned 9 specialist centres for TTP patients within England, and as part of this, psychological support for TTP patients was included for the first time. So there's now 12 of us who work across the specialist centres across the country providing that psychological support. And we're specialised in working in hospital or health settings to support people experiencing psychological difficulties associated with physical health conditions. So in this case, it's TTP.
And in terms of what we do, so psychology can help patients with difficulties when distress is related to TTP, including coping with the stress of the diagnosis or relapse, loss and adjustment. There may well have been significant changes to your life from having the TTP that would be helpful to talk about. Coping with feelings of worry, panic or low mood, changes to appearance or your body image as a result of being diagnosed with TTP. Coping with some of the psychological components of pain and fatigue and other distressing physical symptoms. Changes to memory and thinking abilities, perhaps reliving or remembering past traumatic experiences. There might also be some fear about medical procedures where that can impact on treatment adherence, or perhaps just some support in making health-related changes to better manage your TTP. So these are the common themes across all of us at the different centres, some of the different difficulties that we see with our patients, and these are the main things that we tend to work with.
If you're interested in finding out a little bit more about what the psychologists do at the centres, our colleagues, so Ika and Eliane from Addenbrooke's, had previously done a webinar for the TTP network explaining about psychology a little bit more, which is still available on the website and the YouTube channel, so feel free to have a look at that if you're wanting to.
And this is a direct link in the slides to it, and we are hopeful there'll be more webinars over the coming year with the network. If you're thinking from what we've spoken about today that actually psychology might be something that would be helpful for you to access, I mentioned the leaflet earlier. We've produced a leaflet for today that has the contact details for each of the different centres. So if you contact the respective telephone number at your centre, all the referral pathways are slightly different depending on the centre. So we've all put down the best number to call to say, I think it might be helpful to have some psychology. Can I talk to someone about how that can happen? And then you'll be able to be guided through what the specific process is for being referred at your respective centres. And that was us. Thank you so much for listening.